Hello and good morning.
Hi, good morning.
Thank you for being here. So, Dr. Wendy, first, what are fibroids? And then we'll get into a little bit more Amber's story.
Absolutely. So fibroids are non-cancerous growths that occur in the uterus or around the uterus. So they grow sometimes at different paces depending on the person. Sometimes they'll grow to the size of, cantaloupe, watermelon. I mean, they can get really big, or they can be really small, the size of a pea. And a lot of times how the person has symptoms is determined by their size and where they are in the uterus.
So, Amber, talk to me a little bit about what you were going through with what you were going through each month with your fibroids before you had them removed.
Okay, so I was diagnosed with fibroids at 23. Prior to that, maybe about 3 years prior to that, I began to experience severe menstrual cramps to the point of where I couldn't go to work because I was just in extreme constant pain. My cycle was very, very heavy. I was, changing my pad every hour. I had these huge blood clots that I was passing all the time, and it was just something that I had never experienced before. I actually felt something in my lower abdomen.
Oh, wow.
Yeah, and I couldn't really sleep on my stomach because there was a constant pain there. So it was becoming quite unbearable, but I still didn't go to the doctor for it.
Oh, wow.
So
When did you go to the doctor? Because you were telling me.
yes, it wasn't until my husband and I were trying to conceive, and we did, that I had 2 miscarriages. The first one was in March of 2015. We were super excited when I got pregnant, and at about 7 weeks, I lost the baby. So I was devastated, obviously.
Yeah.
And about 3 months later, we tried again because I still wasn't sure what the issue was. I said maybe that was just the luck of the draw. So we tried again 3 months later, and the same thing happened.
Wow.
And yeah, so it was then that I decided that this was enough. I had to find out what was wrong with me.
So you ended up getting the fibroids removed, and did you tell me one was the size of a grapefruit?
Well, I had 2 that were the size of oranges.
Okay.
2 the size of oranges, and they were, I guess the location is what makes them more painful or
Okay.
will cause miscarriages.
Yeah, Dr. Wendy, tell us what you see. Are these symptoms normal for women that have fibroids? And then also, how common do you see women ignore it? They just say, oh, it's a bad period, because every period is different.
So I think that the one symptom that I want to point out that you mentioned is the fact that you were bleeding so heavily that you were changing a pad every hour.
Yes.
When you talk about changing a pad every, even 2 hours, a soaked pad during your cycle, that can sometimes point to the fact that you have fibroids and that you're bleeding too much. Those symptoms, abdominal pain, the soreness, and I think we have a picture of a uterus itself where you can see that some fibroids can be on the outside of the uterus, some can be in the wall of the uterus, and some can be on the inside. And I think you had one of your main ones was on the inside of the uterus,
Right.
which was why the baby couldn't stay in there and why you miscarried. And that's probably one of the main ones that needed to be removed before you were able to get pregnant and have your kid, your
Right.
child.
Okay. So do you end up having a successful surgery? I know you told me that you were scared to do it, but you had a successful surgery and a successful pregnancy.
Yes, I was so fearful because I had never had surgery before. So it was very traumatic, but I was optimistic because I always wanted to be a mother, and that was very important to me. So to actually have a healthy pregnancy and have a healthy baby, and actually I'm pregnant again now, so I'm 5 months pregnant with my second baby.
Congratulations.
I'm having a boy. Thank
Yes.
you.
So you have a girl, baby Maddie, and do we
Yes.
have baby Maddie here? Oh, here she comes. She's like, what is going on?
Who's that? Who's that?
You can sit here, Jordan.
I'm gonna give it to her mama.
Okay.
Oh, dude.
So we have baby Maddie.
Yes.
And you're pregnant right now. This
Yes.
is something that your doctor wasn't sure. Look how close she wants to be to her mom.
Yes, she
cheek
is.
to cheek.
Yes.
And so this is something that your doctor wasn't sure if you'd be able to do.
Yes, they were not sure. I mean, the chances are higher after you have the fibroids removed, but so they weren't sure if there was going to be scar tissue or anything like that, any complications. But thank God, no complications, a healthy baby. I'm so excited and I'm so grateful for everything.
Okay, all right. Dr. Wendy here saying people need to talk to their doctors and let them know what's going on and be honest with their symptoms. Thank you. Well, you can follow Dr. Wendy and read some of her latest blog posts on her site, dreverywoman.com.